All right, so today we're going to do a quick little video with Dr. Andy, and we're going to talk about basically his updated bio. Everyone's been here now working with us, getting more and more educated along the way. And I asked them frequently to update their bio for me, but they're all a little modest, so I'm going to just ask them today, and we're going to all talk about it. So with that said, Dr. Andy, welcome. How are you today?
Good. How are you, Steven?
I'm doing good, man. So first of all, Dr. Andy's been with us now for about 3.5 years now, almost 4. Or is this 3 and
almost 3?
Almost 3. Okay, see, I got ahead of myself. So almost 3 years Andy's been with us, and in that time frame, obviously we've had COVID, and that's got in the way of some of it. But I want to just kind of talk about some of the things that Dr. Andy's done in that time. When he came to us, he was already certified in Pilates, or completed a Pilates training in New York City, and then completed the certification test shortly after you got here? Or was that in New York still?
I got the certification from the studio in New York, but then after moving to Austin, I completed the certification for the PMA.
Gotcha. And the PMA is now switched and changed to something new, right?
Yeah, so it's National Certification Pilates Teacher, so that's the current title.
Got it. So he came here already having a wealth of Pilates knowledge that he picked up in New York, and was able to start incorporating it immediately with his physical therapy patients here. But since then, he's ventured on and got trained in the gyrotonic work. So most recently, you completed level 1 gyrotonic, is that right?
Yeah, I completed level 1 gyrotonic tower certification last October.
Okay.
And earlier this year, I started on the specialty equipment Gyrotoner, and I'm halfway through it.
Got it. And so with the gyrotonic equipment, or the gyrotonic expansion system, the method, tell us just a little brief thing about how the gyrotonic system helps you with your physical therapy patients.
So I think it goes very hand in hand with Pilates, because Pilates focuses a lot on core stability, so that works very well for people who have too much mobility. Pilates works very well with the strengthening, with the stabilization. But then on the other hand, we have a lot of patients with a lot of stiffness. Then gyrotonic would really come in very handy to help them improve their spinal mobility and range of motion in their shoulders and hips and many other joints.
So you mentioned some of the body parts. What are some of the conditions that you've seen since you've been using Pilates and gyrotonic as a physical therapist? What are some of the conditions that you've seen those systems have really helped with their outcomes?
So Pilates helps a lot with a lot of clients with lower back pain, neck pain, and then that helps with core stability, strengthen their back. And then for gyrotonic, a lot of my clients a lot of them have tight hamstrings leading into hip problems, knee problems, or people with frozen shoulders or different types of shoulder injuries. Gyrotonic exercises help tremendously for those conditions.
Got it. So the Gyrotoner is basically just taking the gyrotonic machine and moving it up to where you can move it in 3 dimensions in different angles and different spaces. Could you explain a little bit of what the benefit is of being able to do, say, the gyro handles at this angle versus maybe this angle, or just kind of what makes the Gyrotoner unique and helpful for therapy as well?
Sure. So like Steven said, the difference is that the plane of the handles or the exercise planes can be not only elevated but then also tilted to a different angle. So that will be more functionally relevant to our everyday lives. Like we might be moving objects on a countertop or on a table, that would be the plane in front of us, but then throughout our everyday lives we might need to reach overhead to an overhead cabinet, or in different planes or different angle that's not just reaching forward, it will be reaching in a diagonal plane with more rotation of your body. Gyrotoner can simulate those patterns better than just the gyrotonic tower.
Got it. That's a good answer. That makes a lot of sense. I've noticed you've worked a lot with pickleball players over the summer, and it seems to range from shoulder to knee and different things. Is there any other sports that you've seen a lot of patients that have wanted to get back to, that's a part of their program that you're using these modalities with?
Yeah. So tennis is a good one, and then a lot of people running.
Mm-hmm.
Yeah.
Got it. Awesome. Now, most recently, this is where I was going a moment ago. Most recently, you've done two things that I don't know much about. I've been the guinea pig of one of them, and that's the cupping. Myofascial cupping therapy. I've called it, heard it called different things. And then animal flow. So let's talk about the cupping first, because you've left a few bruises on me, but I've really enjoyed it. So can you tell us a little bit about what your training is with the myofascial cupping or the cupping therapy?
Yeah. So I took the myofascial cupping course a few months ago, and then that really is a good technique because it's mobilizing the soft tissue in the myofascial system using the cup by creating the suction effect that really helps to elevate the tissue underneath to facilitate the blood flow, and also help to improve flexibility of those tissue. So I don't really need to just rely on my hands and power to do that, because the tool can help me a lot with it, and that actually make a lot of my techniques more effective and more efficient.
And what are people, how do people know of cupping? What is the most common place they see that?
So a lot of people would see cupping at either acupuncture places or massage places, and then depending on different types of theories and frame of references, they might be aiming for a lot of bruising, and then that's the common understanding of that for a lot of us. But then I think a little bit different from I learned from the course is that it's really focusing on how to improve the flexibility and how to use cupping to complement movement. So here I do that a lot by combining cupping with the patient doing some exercises actively, and then that actually help a lot with improving their range of motion.
And if someone were to just be watching TV, when would they notice cupping? When would they be aware of cupping? You following me?
Not really.
What sport? What time of year?
Oh, so you mean like during the Olympics?
Exactly.
Yeah.
So during the Olympics, we see a lot of swimmers. Michael Phelps was, I believe, the most common, the most famous person at the time during the Olympics that would show up and have a lot of bruising, but also win the race that he was participating in. And with that said, we're going to talk about something we didn't mention, but let's talk about taping, because something that gets very common in the Olympics as well is taping, because during the volleyball players, most noticeably, will be wearing lots of colorful tapes on their arms and different body parts. So, and I know that's something that you've been doing for quite some time. So tell us a little bit about taping and the benefits of taping.
Yeah, so I've been doing taping for almost 10 years, and it's used in the sports field a lot by helping to stabilize certain joints to enhance the athlete's performance. But then taping, depending on the different amount of tension you are pulling, actually can help facilitate healing by reducing swelling, by supporting the muscles, or just creating a sensory feedback. It's just so that the body can move very differently. So really depending on how you apply the taping with different tension or patterns, that can serve many purposes for the healing of the patients.
And I've personally have been taped by Andy for different elbow things and different conditions that I've suffered over the years that he's been here. And it's something that I learned very, very little about. Just like the cupping, I know nothing about. We learned like to tape the knee back in the day, like one simple taping technique, and that was it. And Andy pulled out this like spiderweb looking stuff that was crazy looking, and the amount of time and effort that it took to prepare those little, like it was like a beautiful like geocentric, like, I don't know, it was
like
just
a sunflower.
Yeah, it was just very the one you put on my elbow. And actually, it wasn't for that one wasn't for my elbow. It was for a patient's elbow. Yeah, you put different things on my elbow that was a little different, but that's a tangent we're going off on. So now, with that said, we're gonna wrap this up by talking about animal flow. So animal flow is something I don't know anything about, but I know Andy has joined, has learned about it recently, and has pretty close, if not, you're pretty close to completing that certification, is that right?
Yeah.
So tell us a little bit about animal flow and what that's about and who that helps and what that's for.
Yeah, so I just took the certification workshop a month or so ago, and then like Steven said, I'm waiting for the test out results, so I should be fully certified very soon. But then animal flow is an exercise system that's completely body weight, ground based, so no exercise equipment or tools is needed. And then it has a lot of components from breakdancing and gymnastics and calisthenic movements. So it emphasizes a lot of the plyometric contraction of the muscles and the power. And then because it's flowing like a dance, so there's no high repetitions or anything. So while it's challenging the power and more advanced fitness, but then it doesn't really create too much overloading or stress to the joints, which I actually benefit a lot myself, aside from practicing Pilates and Gyrotonic.
And you mentioned it's helped you with a lot of your wrist strength, correct?
Yeah, my wrists are getting stronger by practicing that. So sometimes when I treat patients for the entire day, my hands can feel sore. Obviously, cupping help a lot with it, but then practicing animal flow also make my hands stronger, so I actually don't feel any more soreness from it.
Got it, awesome. And then most recently from continuing education, you took a CranioSacral course with John Upledger's group. Tell me a little bit about the CranioSacral course as far as like what kind of patients you could utilize those gentle techniques with, and just tell us a little bit about that.
Yeah, so the CranioSacral Therapy includes a lot of myofascial techniques based on listening to and adjusting the craniosacral rhythm by adjusting the myofascial system. And then by doing that, I've been finding some success when working with patients with migraines, and also a lady who is having a flare-up from rheumatoid arthritis. I've been doing some techniques to help her relieve the flare-up. Those other techniques wouldn't last for longer than 1 or 2 days, but then I used some craniosacral therapy techniques on her, and then last week she told me that she was staying symptom-free for 5 or 6 days.
So it's increasing the amount of time.
Yeah.
That's awesome. So it's always great when you take a course and start seeing improvements, and you know, even if you take just a couple little things from it and start implementing it with your patients, that's an immediate positive. It's pretty awesome. My experience with craniosacral therapy, when I first signed up for a course, I knew nothing about it, and as I was laying on the table receiving it for the first time, I was feeling things in my knee, I was feeling things in my head adjust and pop, and it was the most bizarre thing I had ever experienced, because it was so different than the very forceful, aggressive stuff that I was used to, and people digging in and, you know, using their elbows on me and manipulating me. And so it was all of a sudden, I'm like, what are you doing? Like, I don't even feel this. But it was such a powerful experience, because it really helped to kind of, as I was bringing awareness to my body with Pilates, it helped me to kind of relax a little bit and get out of some holding patterns to allow what I was re-educating my body with to be a little bit more effective in my mind. So I find it's a very great thing for helping headaches, migraines, like you mentioned, whiplash type of situations. And it's an interesting thing that I'm glad you and Danny both are learning a little bit about this, because it's something that that it helps many people along the way. So that is our video series, our bio update with Andy. I knew this was going to take a while because he's been doing so much great stuff. So with that said, we've talked about CranioSacral Therapy, we've talked about animal flow, we've talked about Gyrotonic, Gyrotoner, we've talked about Pilates. He signed up to do some gyrokinesis work real soon, which is just the mat version of Gyrotonic. And I think that's our summary for that. So with that said, thank you for your time, Andy. Thank you for your commitment to your patients. Thank you for your commitment to the industry to keep getting better and to keep serving people at a high level. And if you haven't been to our Google page, he's got like 5 incredible Google reviews in the last week alone. So just, you should read those. With that said, y'all take care, and thanks a lot, Andy.